Diet textures relate to the consistency of food. Individuals who struggle with chewing or swallowing run the risk of food traveling into their windpipe and trachea, which lead into the lungs. This is called aspiration and can lead to upper respiratory infections, pneumonia, and even death. Individuals may not be able to chew their food enough and food could get caught in their throat. Therefore, when an individual has trouble chewing or swallowing due to a certain medical condition, their diet must be altered or modified in order to prevent choking. The adapted diet textures outlined through this presentation provide safe and optimal nutrition for individuals who suffer from disorders related to swallowing. The technical term for people who have trouble chewing and swallowing is dysphagia. Today, we will outline the various levels of diet textures included when working with someone who has a swallowing disorder. Most of the time, an occupational therapist or speech-language pathologist working with a physician makes recommendations to ensure that a person is on the diet texture diet that is safe for him or her. It is important to remember that people on altered diet textures can generally continue to eat the foods they have always loved. They just need to be prepared differently. There are 4 levels of diet textures related to solid foods. These include regular, chopped, ground, and pureed, also known as dysphagia diets levels 1, 2, and 3. A regular diet. To prepare a regular diet, no precautions are necessary. The individual should be able to manipulate their food into bite-sized pieces and successfully chew and swallow their food in order to eat a regular diet. We will use the meal of lasagna with a side of vegetables to show how this meal can be adapted to the remaining diet textures. Dysphagia level 3, advanced, chopped diet. This diet requires food particles to be cut into pieces with a diameter of 1 inch, or roughly the size of a quarter. Food particles need to be moist to ease chewing and swallowing. To prepare lasagna for an individual on a chopped diet, make sure to cut into more smaller, manageable pieces approximately 1 inch in diameter. Vegetables need to be cooked and cut into small pieces. Foods to steer clear of when an individual is on a chopped diet include very hard foods, very sticky foods, or very crunchy foods. For example, raw vegetables, peanut butter, or popcorn would not be advisable. Dysphagia level 2, mechanically altered, ground diet. This diet texture group consists of foods that are moist, soft textured, and easily stay together within the individual's mouth. Bites should be no larger than 1/4 of an inch to reduce the risk of aspiration. To prepare foods for an individual who is on a ground diet, a food processor or blender can largely ease the stress of cooking. To prepare lasagna, the lasagna should be processed using a food processor to soften the texture and decrease particle size. Vegetables should be cooked, cut into pieces, and need to be fork tender. You may add moisture if necessary to ensure that food is not too sticky. Dysphagia level 1, pureed diet. A dysphagia level 1 diet consists of pureed, homogeneous, and cohesive foods. The pureed food should be smooth with no lumps, similar to the texture of pudding. In order to achieve this texture, use a blender when preparing foods. For this diet, the lasagna needs to be blended. Broccoli is not a safe vegetable for a dysphagia level 1 diet. We will demonstrate a different vegetable by pureeing peas. A great example of a pre-packaged food for someone on a pureed diet is applesauce. Regular diet. Chopped diet. Ground diet. Pureed diet. There are 4 levels of diet textures related to liquids. These include thin liquids, nectar-thick liquids, honey-thick liquids, and spoon-thick liquids. In order to prepare these thickened liquids, thickening agents are applied. The agents used to thicken liquids are available in several forms. You can purchase thickeners in either a starch or gel form. Thickeners can be purchased from your local drugstore or ordered in bulk. Pre-made, shelf-stable thickened liquids can also be purchased. These tend to be more expensive but are much more convenient to use. Thickening agents will list the appropriate ratio of liquid to thickener on the labels. You can prepare any of the following liquid variations with any of the drinks that you enjoy. For this presentation, we will demonstrate the thickening process with water, soda, and coffee. Thin liquids. These are your typical drinks without any added thickening agents. Nectar-thick liquids or syrup-thick liquids. Nectar-thick liquids are slightly thick in consistency, which you can feel while stirring. When you pour from a spoon, the nectar-thick liquid will fall off the spoon and drop. To prepare nectar-thick liquids, apply the nectar thickening agent to the required amount of liquid as the packaging suggests. Be wary that each thickening brand has its own set of instructions. Hot drinks may require a little more thickener than cool drinks. Milk will require less than water. When mixing the thickener to the liquid, it is important to stir vigorously and let the drink sit for 3 minutes so that the thickening agent can fully form with the liquid. Honey-thick liquids. Honey-thick liquids have a consistency like honey that is sitting at room temperature. When you pour from a spoon, it comes off in sheets. To prepare honey-thick liquids, apply honey thickening agent to the required amount of liquid. Spoon-thick liquids, pudding-thick liquids. Spoon-thick liquids are thick like pudding but smooth. They should plop off of an upside-down spoon but not look like mashed potatoes. To prepare spoon-thick liquids, apply the necessary amount of thickener to the liquid. Thin liquids. Nectar-thick liquids. honey-thick liquids, spoon-thick liquids. When individuals have poor oral control, choking is a very real hazard. Without an altered diet and close supervision, eating a simple meal can be deadly. It is imperative that these guidelines be followed when preparing meals for individuals who struggle with chewing or swallowing. You can also ask your primary medical physician, occupational therapist, dietitian, nurse, or speech-language pathologist for more information regarding diet texture, safety, and preparation.